Martinez. I am a physical therapist with Dulce. So before we start, I'm gonna ask you some questions just to see where we're at. Okay? How are you feeling today?
A bit of a shortness of breath.
Shortness of breath. Okay. How do you feel when breathing normally? Like on a regular day?
It's kind of hard to breathe. I used to smoke for 15 years. Stopped smoking 6 years ago.
Okay. Do you do any daily exercise?
I don't really walk much or exercise, so I would say no.
Okay, that's fine. Do you have any heart conditions? Any recent surgeries?
No.
Nothing? Okay. Are you taking any medications?
As of right now.
No? Okay. Okay. So I'm just going to check your breathing, the lungs. Okay, I'm going to ask you to inhale. Okay, release.
The physical therapist may also measure how well the patient is breathing by pulmonary function testing. One of the different types that we have here is spirometry testing that will measure the volume and flow you can move air into and out of your lungs. The computerized sensor will then graph the results, and two important measurements to read are FEV1 and FVC. Forced vital capacity measures the amount of air a person can forcefully and quickly exhale after taking a deep breath. In the FVC test, the forced expiratory volume can be measured on the amount of air a person can forcefully exhale in 1 second. Now, after looking over contributing factors of the patient's age, gender, height, and weight, the ratio of FEV1 over FVC gives the following percentile ranges. As you may see, anything below 70% would be categorized as obstructive, and depending on the percentage, also gives the severity of the disease the patient has. Ms. Martinez will be an example of a patient with a moderate case of COPD. After taking the blood pressure, she is here performing a cardiovascular exercise by walking on a treadmill, and this will improve endurance and also warm up the muscles for the following exercises to prevent any injuries. We also want to make sure that the patient is not feeling like they're overworking their heart or feeling out of breath. So it's always important to ask how the patient is feeling.
How are you feeling with nothing? Everything good? You're feeling a little bit dizzy? Okay, so now we're going to start. Okay. So I'm going to help you. Check your blood pressure. Same, just to check how you are. Turn it a little bit towards me, like that. I'm gonna have you sit down. Come over here. Okay. And do you need help? Okay. Let's have a seat. Sit down.
Thanks for sitting down. There's more again. If you don't mind, and if there's not anyone else, I would like to go because they go because
Have you lay down? We have some pillows in the back. Lay down. Just relax. I'm gonna keep this way. Lift up your head. Right here. Yeah. How do you feel? You comfortable? You okay? You want pillows? You're good? No pillows? Okay. So now I'm gonna ask you to go ahead and get your right hand, and you're gonna place it underneath your rib, like this. Okay. And then your left hand, right? You're gonna put it on top of
The patient is now performing breathing exercises that can be done within 5 minutes, and this is just to work the correct respiratory muscles. So by having one hand underneath the rib cage and the other hand on the chest, the only hand that should be moving is the hand underneath the rib cage every time the diaphragm contracts, and relaxes each time she inhales and exhales.
Go ahead and inhale. Exhale.
One thing that occurs in patients with COPD is the production of excessive mucus in the bronchi of the lungs, and a technique applied to promote mucus removal is postural drainage. So depending on which lobes of the lungs the mucus is in is how the patient will be placed in a certain position. The therapist then applies percussion and vibration over the specific lobe of the lung to promote the movement of the mucus, and coughing immediately after helps